Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Hello and a very good morning to your dear viewer of Capuchin TV, and welcome to the Health Corner show with me, your host Susan Bulemi, of course sitting in for Maureen Kimani. And on this week's episode, we'll be having a discussion on audiology, rather understanding audiology and caring for your hearing health. And of course, we are coming to you live from St. Mary's Mission Hospital, whereby I am joined by one of the doctors who is a specialist in that sector, and she'll manage to shed more light on that topic of discussion and give us more understanding on what we need to know when it comes to matters concerning the hearing health. Remember, our dear viewer, if you'd like to participate in today's conversation, you can always send us an SMS via our SMS number 21760, or leave us a comment on our social media handles and your message will be delivered. And now I'd like to give Daktari the opportunity to introduce herself to you, our viewer. Karibu sana.
Good morning.
Good
I'm
morning.
happy for having me here. My name is Agnes Kagendo, clinical audiologist at St. Mary's Mission Hospital. I've been working at St. Mary's for the last 7 years. So currently we are doing this hearing and hearing care technology at St. Mary's Clinic, Audiology Clinic.
Oh, thank you so
Welcome.
much, Dr. Agnes, and Karibu sana.
Asante.
And maybe first and foremost, before we even get into the topic, first of all, for the viewer who is watching, maybe you could simply explain to them what exactly does an audiologist do?
Okay, that's a nice question. Audiologists, we are specialized on diagnosing, treating, preventing hearing and balance disorders. Yes, so we do this for all the ages, starting from the neonates who needs hearing screening to up to the old age. Yeah.
And of course, when we talk about the hearing health, of course, I have to ask, how common are hearing related cases here at St. Mary's?
Hearing loss cases are many in St. Mary's. Currently, we are able, in a month, we are seeing like out of the 100% patient that we see in audiology clinic, 50% is a hearing issue, and out of the 50%, around 50% again, they have hearing loss who needs rehabilitation. Yeah.
And okay, what age groups are most affected by hearing problems in your experience?
In my experience, hearing loss cuts across all the ages. But basically, for at St. Mary's, most of the patients that we are able to get is the old age who have hearing loss. Children, yes, but a lower percentage, but the rate of hearing loss is increasing as we go. The adolescent, because of the exposure to loud sounds and noise in recreative areas. Yeah.
Oh wow! And you've actually mentioned that we do have an audiology clinic here at St. Mary's. So what services can people expect from this clinic?
From this clinic, you expect for hearing evaluation, hearing aid fitting, or rehabilitation for the hearing loss, balance assessment and rehabilitation, tinnitus management, counseling. Yeah.
Oh wow! And okay, you've mentioned you've been in this field for 7 years now.
I'm not working in this field.
So how do you test someone's hearing when a patient comes in?
Okay, ideally when a patient comes in, first I have to listen to that patient and know what ideally brought the patient to the hospital. So it's we call it you listen to the history of the patient to know why the patient is looking for this service. So after you find out that they have signs of hearing loss, then we do a hearing test where we use equipments to evaluate for hearing, the level of hearing, the degree of hearing, and the type of hearing that the hearing loss that they have. Yes, so it is done in a acoustic room or soundproof room where these equipment are there and the patient is there. You test the patient in a silent room. Yeah.
And what are some of the signs that one should experience for them to know that they should come to the clinic for a checkup and maybe they require treatment?
That's a good question. For the sake of the viewers, I would be a bit not be very technical, but anytime that you feel like you are not you are struggling to understand a conversation in a noisy environment, anytime you will see that you are turning your TV louder than others can prefer, anytime you are experiencing tinnitus or noise in your ears, those are signs of hearing loss. So it's good when you see those signs, come for checkup. Yes.
And maybe when a patient comes in, probably they have an issue. Is it, do you have cases whereby maybe one says their ears are in pain, or is it painless? They just have those signs, but it's painless.
Yeah, I started by saying you listen to the patient.
Yeah.
Of course, for the patient to come in with a symptom of, I have a ear problem. So it's for you as a doctor to know what kind of a problem they have.
Yeah.
One, they may complain of that pain if they have been having infection. Some may not complain of the pain, they complain of difficulty or inability to hear, or difficulty in hearing, or reduced hearing for a long time or for a short time. So it's for you as a clinician to know if this patient is having infection, which could also lead to hearing loss. So you refer this patient for ENT management, where they are treated for the infection, and then later they can come for hearing assessment when they are healed from the infection. So we don't do it when you have pain. Yeah.
Oh, and also, I'm also curious.
Yes.
Sometimes you might be scrolling online and you come across a clip and someone is saying an insect crawled into their ear. Have you ever come across such?
Yeah, they are common, especially for children.
Yeah.
There are those who come with the insect in their ears. There are those who come with the beans they are put in the ear, especially for children.
Yeah.
For adults, insects are the common foreign bodies in their ear. So they are common cases. Yeah.
Oh, wow.
Yeah.
Okay. And let's talk about some of the causes of hearing loss among patients that you've received. What are some of the causes?
Okay. Generally, there are many causes of the hearing loss. There are those we call environmental, genetic infections. For the adults, the common causes could be ear infection, a long-term ear infection. Could be also exposure to loud noise, especially for those who are working in noise environment, for those musicians who work at like DJs. Yeah, they are at risk of having hearing loss if they are not protecting their ears. For the children, could be genetic, maybe a family issue, or they have some cases like Down syndrome. Could also be an infection after birth.
Yeah.
After birth, if the child was admitted in newborn clinic for a newborn ward for more than 2 weeks, there is a risk of getting hearing loss because of the infection that they got. Also, the child who has been exposed to meningitis, malaria treatment. There are also causes, there are also hearing loss caused by drugs. We call it ototoxic hearing loss. Ototoxic drugs that we use in hospitals, if they are not used cautiously, they can lead also to hearing loss. You remember the time of quinine?
Yeah.
When you get a quinine treatment, most of the times when I was a kid, I could hear people talking about noise in the ear after quinine injection. So such kind of drugs can lead to hearing loss. So it's advisable not to use over-the-counter drugs because you don't know which one is ototoxic.
Yeah, true.
Also, infection during, we call it antenatal. There are those infections with the mother that can lead to hearing loss. Yeah, so it's advised for mothers to attend the NC clinic for screening of those infections and also for the supplements.
Okay, and let's talk about an example of an infant, maybe a baby who's just been born. And is it possible to know at that stage that a child has maybe a hearing issue, or the child has to grow to a certain age, or probably to certain months for you to realize there is a hearing issue?
Not really, not at all. So for the neonates, as audiologists, we advise on what we call newborn screening. After birth, they are screened for hearing loss. There is a machine we call, there's a device we call OAE. That one we use it on screening for neonatal hearing loss. If you find out that this child has a you are suspicious of hearing loss, you will repeat this test after 3 months, then after 6 months. If it's still there is hearing loss, you do a diagnostic test for this child, because we are advising on early intervention for early identification for early intervention, which will lead to a quality life for this kid. Yeah.
And on that same breath, what signs should maybe a parent look out for in a child to realize? Yeah,
okay. In a child, I would start with the neonate. Every mother who has given birth, it's important for this child to be screened for hearing loss. But if this child was not screened for hearing loss, at 6 months, a child is supposed to respond to sound, to turn to one sound. If the child is not turning to that the source of sound, suspect hearing loss. Also, as the child grows, the way you communicate the sounds, if there is a speech delay, if the child is struggling in a noisy environment, it's important to look for hearing assessment for this child. Also in school, sometimes we say this child is naughty, but maybe they are not hearing, so they are not paying attention. So many times when you get kids who are 3 years, at 3 years they have not been diagnosed with the hearing loss, not because the mother did not notice the signs, but because mother ignored the signs, and also the teachers ignored the signs. So currently we are creating awareness to telling teachers not these signs, and the parents not these signs. So those are the signs that the parents need to check on.
So if still on the children, if a child has a hearing issue, it may affect their speech development and also their learning, right? Okay, so let's talk about now diagnosis and treatment. What are some of the treatment options that are available for patients with hearing challenges?
Before you go to that, on the impact of hearing loss to children, as much as it will affect the learning, literacy, also social interaction will be affected for this child.
Okay. So it may affect a lot how they even relate with their fellow children and everything.
Because they keep telling other children repeat, and these children maybe are irritated and they like ignore him or her, so they are affected also socially.
Okay, so now moving on to treatment and diagnosis. What are some of the treatment options?
Okay, for the treatment, it depends with the degree and the type of the hearing loss. If I may just be a bit of brief to describe the types of the hearing loss and the degree. Sure. When you talk of types of hearing loss, there is that conductive hearing loss. You complain of the inability to hear, but it's wax that is full in your ears. You have the insect that you talked about. Maybe you have infection that is causing that conductive hearing loss. So for the conductive hearing loss, we do it medically. We treat the drugs and clean the ear. Then after that, we reassess. For the hearing loss, we call sensorineural hearing loss, that is involving the inner ear. It is graded from mild to profound. Mild means you are able to hear but not very clear as you're supposed to. Moderate, and then we go to profound, where you can hear loud sounds or you cannot hear at all. So depending on that grading, we decide on treatment. So for the children, there are options. There is hearing aids. We use devices to amplify the sounds that comes to your ear. There is also cochlear implants. When it is not, the hearing loss is identified as early as possible, we do hearing cochlear implant for the children. But for those who have profound to severe to profound hearing loss,
Okay, and you've talked about hearing aids, and over the years, hearing aids have changed a lot. What should people know about them today?
For sure, our goal is communication. And if you're not hearing well, you may not be able to communicate. It's not all about sound. So hearing aid is not just about to amplify the sound, it's to make the speech clear. It's not about for you to hear because you can hear any sound. It's about to communicate, and there's a risk of traumatizing the eardrum. There's a risk also of impacting that wax further. So it's not advisable to use earbuds. It's good if you hear you have a aura blockage or you have a blockage in your ear, go to the hospital for checkup so that they know if it's wax, they clean before it's worse.
And also there are times we are told that a little bit of earwax is not bad. Is it true, or is it just me?
Yeah, for sure. The wax is it's normal. It's good for your ear because it's there to protect your ear, to trap the foreign bodies, to trap some other organisms that come to your ear. So it is important in your ear, but when it is too much, it causes ear blockage.
Okay, thank you so much for that. And earlier you talked about public awareness, but you didn't get much into it. So what role would you say public awareness plays in preventing hearing disorders in the community?
It plays a big role because one, people will be aware that there is hearing loss and it has a lot of impact in the society. So when the public is aware, the objective of early identification and early intervention will be achievable when the public is aware.
Okay, and still on public awareness, here at St. Mary's Mission Hospital, are there maybe any awareness programs or medical camps that you hold for that?
Yeah, we hold school program, hearing screening programs, and also public ear screening. We do it at our hospital. Sometimes we go to the schools.
And also, as we are about to conclude, how can people access your services here at St. Mary's Mission Hospital?
As St. Mary's Mission Hospital, we believe in compassionate healthcare and a comprehensive healthcare. So we have our clinic open every day, Monday to Friday, and we are having these services. You can still book through the clinic services or get a referral from your physician or your doctor who is attending you. to our clinic. Yes.
Okay, thank you so much. And in your experience, what would you say has been motivating you so far in whatever you've been doing in helping people with hearing difficulties?
What motivates me so much is when you are attending a patient who came to you not able to hear, and then maybe you do a rehabilitation and they tell you, wow, I can hear. That's one thing that tells you, oh, I've done something to this person. It's not about like giving them that machine. It's about how they feel about it. How does it help them? So we believe in that. How is it helping the society? How is it helping this person that you're attending to? So we do it like it's personalized, the service.
Well, that is all we had for you here on the Health Corner Show. And of course, I was here with Dr. Agnes Kagendo, who has helped us learn more about audiology and our hearing health. And like she said, do not ignore the signs. And here at St. Mary's Mission Hospital, they do have a clinic whereby they'll help you identify any hearing issues you have and give you the appropriate treatment that you might require for that. I have been your host, Susan Bulemi, sitting in for Maureen Kimani. Until next time, stay safe, be blessed, and remember to always keep it Capuchin TV.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.